Well, good evening, everyone. Welcome to our Ask the ARC webinar this evening. My name is Carly Shortino Poulter, and I'm the director of the ARC Advocacy Network at the ARC of Indiana. Tonight, we are joined by Kathy Robinson, who's the Associate Director of the Division of Disability and Rehabilitative Services, Holly Wimsat, the Director of the Bureau of Disability Services, and Leslie Huckleberry, the Director of the Division of Aging. And tonight we're going to be talking about the proposed changes to the Medicaid waivers. I know there are a lot of questions out there, and a lot of people, um, have heard a lot of things. And so one of the things we wanted to do is make sure that people are getting accurate information, getting up to date information, because some of these things are evolving as we go along. And so we're going to hear directly from state staff about what is included in these changes. We've had individuals submit questions in advance so that they could prepare for tonight. If you have further questions, you're welcome to put them in the Q&A section tonight, but we're going to save those questions for Monday so that they can be able to do the research and make sure that they're giving the most up-to-date answers possible. And so at this time, I'd like to turn it over to Kathy so that she can speak.
Hey, thanks, Carly. Appreciate this time and everyone for carving out some of their schedule for this presentation, and appreciate, as always, the partnership that FSSA and has with the ARC of Indiana. And Carly, in particular, has been a wonderful advocate for individuals in waiver supports and across service systems. So we're really thankful that she requested and reached out to us to do a couple of webinars to talk a little bit more about some of the changes. And so I have, as she mentioned, Holly Wemsat, the BEADS director, and Leslie Huckleberry, who is the current director for the Division of Aging. And we are really going to just talk through some information and updates with you regarding both the Medicaid forecast and FSSA's home and community-based services waivers, and some of the changes that some of you may have been made aware of, as well as the public comment period that's currently ongoing from through the 16th of February through next Friday. So we were wanting to identify a couple opportunities before the end of that public comment period to be able to share some information with you. And as Carly mentioned, she did share with us questions ahead of time that she had been compiling from you and others as we were looking to set up this webinar. And so to the best of our ability, we're going to try to answer as many of those questions as we can. And anything that we are not able to answer, we may be able to answer next week. As Carly said, things are evolving in terms of as we are able to update our information, as we are able to gather more data. We'll have more information to share with people as we move forward. So with that, we can go ahead and get started. I'll let Carly queue up some presentation slides just so that we can you guys have some information to look at as we talk through some of this, and appreciate, again, Carly driving the slides as always, because we're going to be changing hands here a couple of times to talk about some of these different pieces and parts. And so with that, I will go ahead and get kind of started to just kind of give you an overview of the agenda for the next set of slides for Holly and Leslie and I to walk through. So Carly, can you move to the next slide? And so, as I mentioned, we've been trying to share some information and clarifications around the Medicaid forecast update. Some of you may know some information was released in December of 2023, so just a little bit ago, regarding the Medicaid forecast. And so we'll talk a little bit about that in this presentation as we set the stage to share some information about those waiver amendments that I just mentioned. We'll also talk about the waiver transition itself that has also been impacted by the Medicaid forecast information. And that information has also evolved as well. As many of you may recall, we've been talking for a while about the waiver transition work and what that was going to look like. And that has obviously been affected by some of the information and some of the things that we'll be doing as part of that waiver transition. And then, of course, we want to make sure you are aware of the waiver draft details and the second public comment period. This is a follow-up public comment from a previous set of amendments that we put out for public comment. We have incorporated some public feedback into this set of amendments. Holly will talk a lot about the details of some of those changes. And as we mentioned at the start, we fielded a lot of questions from you all. Carly compiled those and sent those to us for us to look at as we go through this presentation. So our approach is to really try to address a lot of those questions in the course of the presentation so that hopefully things flow and you get the answers that maybe you're looking for within each particular section of this presentation. So that's kind of what you can expect over the course of the next few minutes with us. So I'll have Carly transition to the next slide. So with that, I am going to kind of pass it over to Leslie Huckleberry to start the conversation to just talk a little bit about the December forecast and how that impacts kind of what we're doing today.
Thanks, Kathy. Good evening, everyone. As Carly and Kathy mentioned, my name is Leslie Huckleberry. I'm the director with FSSA's Division of Aging, and I'm going to talk a little bit here about the Medicaid forecast. So as many of you know, and as noted in FSSA's presentation to the State Budget Committee, the state team identified a potential $900 million variation from our April 2023 Medicaid projections. The FSSA team has been working really hard to continue reviewing our data, policies, approved waivers, and current waiver drafts to better understand those drivers behind the variance. We really did this in order to truly understand the issues, in order for our approaches that we implement to be as tailored as possible. And we have worked to maintain our focus on all the people we serve and sustaining that forward momentum on our existing agency initiatives as well. Next slide. So some of the drivers of the forecast variance are outlined here. So these items summarized were identified as the primary drivers of the forecast variance based on our review and analysis. So I'll describe these briefly here. So the decrease in federal FMAP, the federal government funds a percentage of the Medicaid program, and then state dollars make up the remaining percentage. And the percentage that the federal government funds can vary and is redetermined every 2 years. And so there was a small percentage decrease in that federal FMAP. And while it was a small percentage, the impact in a budget the size of Medicaid is significant. I would point out that the FMAP, this change in FMAP is ultimately actually a positive for the state overall because it's an indicator of our improved fiscal position. That's part of what that percentage is based on. The next driver that we identified was pharmacy rebates. They were less than anticipated, and so that had a bit of an impact as well. Delayed implementation of the ABA rates had an impact just as a variance from what we had forecasted back in April. And then additionally, there was an unanticipated growth in enrollment and utilization on the aged and disabled waiver. In our review of the data, specifically that growth appears to be related to the rate of utilization of attendant care specifically. Next slide, please. So as I mentioned before, we're really trying to take a tailored approach to our strategies to minimize the overall impact to recipients and really focus on strategies that actually address the specific drivers of the forecast. So we did identify some broad strategies as well to minimize the impact of the projected forecast. And Kathy is going to talk a little bit about these next. So I'm going to hand it back over to her.
Thanks, Leslie. So as Leslie mentioned, as we've been looking at as an agency, the overall strategies to make an impact on that projected budget or forecast, I think a couple of things to just note. A lot of the strategies we've identified, again, are really intended to minimize overall the total impact to the Medicaid population as a whole. We have been really identifying key strategies on the A&D waiver as it relates to where we're seeing that utilization growth, the enrollment growth, and some of the dynamics there. I just want to note we have not identified a total budget or a allocation amount that's going to address the full projected shortfall. And so those are continuing areas of consideration that we are looking at within Medicaid. A couple of things that are noted here that we did decide to utilize or look at as part of that overall shortfall. The Home and Community-Based Services Enhanced FMAP reallocation. And that really is during as a funding source that really was available to states as part of the public health emergency and as a way to infuse dollars into the home and community-based services waiver space to build infrastructure and support ongoing operational need of those waivers. And so those dollars are an enhanced match that the federal government is offering to states. That Leslie kind of talked about that FMAP piece earlier, the federal component and the state component that together make up the overall kind of dollars that are getting leveraged to fund Medicaid waivers. The enhanced FMAP is an additional amount that the federal government is offering states as states work to kind of return to normal from that public health emergency, and the recognition that home and community-based services were notably impacted by that public health emergency. And so we have additional dollars coming into the state, and the consideration here each how those dollars could be reallocated in a way to help address that budget shortfall. A number of those dollars have already been accounted for in other ways. So there's continuing to look at that. And then many of you know during last year, FSSA, in partnership with the ARC and other advocacy groups, including NR through the Provider Trade Association and other provider trade associations, we're looking at increasing the rates for home and community-based services. And so you saw during the last budget session a big infusion of dollars into home and community-based services with the intent of increasing provider rates and updating the provider rate methodology for waiver services. And so that effort was pretty large, and the goal in that effort was to drive the wages for the DSP workforce up to ideally around $15 an hour with that rate increase. And so that rate increase was very necessary to support resources and provider stability in the home and community-based services space. With that, there was a 2% rate indexing included, which really was a recognition that the state really wanted to move toward a space of periodically, on a regular, predictable basis, evaluating rates in home and community-based services. The next 2% rate indexing would have occurred as part of the next fiscal year, and we are pausing that 2% rate indexing in light of the budget forecast information. Next slide. So I want to talk here a little bit. This is going to be we're going to spend a little time on this slide just to make sure that we're covering all of the bullets here. We are looking at a number of the key strategies here that were specifically identified for the aged and disabled waiver as a way to evaluate both the dynamic with the enrollment growth, but also understanding where are some areas where we have identified places where we maybe have an opportunity to align practices with existing other home and community-based services, but also address where we feel like there are budget shortfall areas that are impacting where we are right now with the Medicaid forecast. And so the first one I'll just talk about briefly is reviewing service plans. And so there are as many waivers operate from state to state. They oftentimes utilize an approval process where a certain percentage of plans are auto-approved and a certain set of plans are looked at by state staff for quality compliance and assurance purposes. And so we're in the process of adjusting our process internally to have a different approach to reviewing plans. That really just means we're going to look at more plans, just to better understand some of the dynamics that we're seeing with service utilization, but also um, service definition compliance. And so, as many of you know, a lot of the different service array on the age and disabled waiver, we have lots of different service array on the other waivers as well. But really focusing on the service definition compliance within the aged and disabled waiver, what's allowable, what's not allowable, and potentially providing some training on certain service definitions where I feel like maybe there's some confusion about what's allowable within those services and what's not, and also just ensuring that people understand what the purpose of those services are really intended for. Um, and that's a kind of a broad stroke description there, but it also kind of feeds into this third bullet, which is structured family caregiving provision for legally responsible individuals. This is an area where, as a state, we obviously have been evaluating what's currently happening on the age and disabled waiver as a result of the Medicaid forecast information, but also identifying as a part of that, separately, that we have been allowing, as a state, legally responsible individuals to provide paid care under attendant care to their spouses or minor children. And the current federally approved waiver that is operating on the aged and disabled waiver today does not actually allow for legally responsible individuals to do that under attendant care. And so, as a state, we had some decisions to make about how we were going to course correct there. I think at some point we felt like we had appropriately indicated within that waiver that we could allow legally responsible individuals to provide that care, but have since discovered in our coordination and conversations with CMS that that has not been appropriately documented. And so we are moving toward allowance of the legally responsible individual component to structured family caregiving. And this just means while parents of minor children and spouses will not be able to provide attendant care, they could be providing structured family caregiving, and currently working on some information to share with families so that they understand a little bit more about what that transition and the service definitions for those look like and comparatively. This really is an area where I think, we obviously have gotten a lot of questions and feedback around, and can talk a little bit more about really why we're doing that. I think one of the questions that Carly mentioned to us and brought forth was really around ensuring that there's adequate staff before taking LRIs out of the picture. And I think a couple of things that we have tried to strike a balance with is that one, as an agency, I think we to generally support the idea of parents and others relatives providing paid care. I think it's the infrastructure that we obviously do not have to actually be able to support that in a manner that complies with what CMS would say states have to do in order to ensure that we have the right protections and quality assurance elements in place that we just do not have today. LRIs are not being taken out of the picture. They just will no longer be able to provide that paid attendant care piece. They'll obviously continue to be able to provide paid care to their spouse or child under that structured family caregiving service. And we're looking at, again, some additional communication that we can release and share with individuals and families about what that could look like for them given their situation. A couple of things that I just want to note here for this piece that folks may be hearing about here soon, and that is a bulletin that went out to providers of attendant care and structured family care recently about a billing change that is going to be taking place beginning March 1. And that billing change will require providers to indicate on their claims the LRI information, because again, this is information that we don't feel like we are appropriately or accurately capturing to the degree that we need to today. And so that claims edit requirement will be put in place beginning March 1. We'll also be asking attendant care providers to send us this information as well so that we have a good picture and understanding of the degree to which this is happening today and how to help people appropriately work toward a transition plan. So right now, we are allowing the legally responsible individuals who are providing paid attendant care to their minor children or spouses to continue. We have not ceased the practice at this point. We have allowed it to continue with a notification to stakeholders to let them know that we'll be transitioning that option in July. And so we're really just trying to help people start thinking as soon as possible about potentially transitioning what their services and supports look like today um, into whatever works for them. That may be structured family caregiving, that may be attendant care through different service delivery modality for relatives or other staff. It could be other services depending on the needs of the individuals, and that's really where the person-centered planning process should be helping identify what those really are. And so with that, I would say there's some other kind of information that we'll be reaching out to people about in order to really understand the context for families, how this is impacting people. If you're an LRI, you're providing paid care as a parent to your minor child or spouse. Be looking for your care manager to reach out to you soon, because we're going to be helping them as well, providing them with some training, and also asking them to help gather some planning information to help teams really think through this on a case by case basis, so that people are really taking a person-centered approach to what this transition would look like for them. The pediatric eligibility, we're just going to do some additional training here across FSSA. Really, I think we've identified that for future planning, we really need to identify pediatric tools for assessing youth, because the tools that we are using today just aren't really recognizing some of the developmental uniqueness and considerations of that pediatric population. So you'll be seeing us do just some additional training around that. I think future planning here is really referencing not today or tomorrow, not in this set of waiver amendments, but potentially down the road, identifying pediatric tools that assess kids specifically and integrating those into our waiver processes, so that we are hopefully better supporting families, individuals and families in planning, and also potentially helping to prevent, in an ideal state, families from having to go through multiple doors and get multiple assessments to figure out what waiver options they have and what waiver they would be most eligible for, or be most appropriate for. So stay tuned on that piece. That's going to be something that we'll be planning more long term, because changing those tools or introducing new assessments is not something that we can do overnight, nor should it be something that we would want to do that quickly. And so just some additional information about that piece. Expedited waiver eligibility pause. During the public health emergency, we were piloting a expedited waiver eligibility. That is something that, as we were working to roll out on a statewide basis, we really felt like that we were not best positioned to do that, as far as some requirements that CMS was looking for, as far as the steps that we needed to take there. So, in talking with them, we've made the decision to pause that for now. And then finally, our waiver slots. And I'll just note that, for the aged and disabled waiver, the decision to maintain the number of available slots on that waiver, and at just a very high level, that is the way in which we identify funding for the aged and disabled waiver, is to identify how much does it cost to support a number of individuals on that waiver. And so we have held steady with that. We are not reducing the number of waiver slots for people. So I also just want to ensure that people know that we have not done anything with regard to that, but we are holding that slot number steady, but just recognizing that also is a strategy that we're looking at to try to look at and evaluate how that enrollment growth and service utilization may be impacted. So with that, I'm going to I'm going to turn it over to Holly because Holly's going to go through quite a bit of information really specific to the waiver redesign, the waiver transition, and some of the specific changes that are being proposed across the different waivers that are currently out for public comment. So Holly, I'll pass it to you.
Thanks, Kathy. And I got an echo back. Okay. Thanks, Kathy. And thanks, Carly, for the invite tonight. We're glad to be here today. Just going to spend some time going over, as Kathy mentioned, our waiver redesign and waiver transition. And we'll talk about the waiver amendments currently out for public comment as well. So you may be aware that BEADS has been engaged in a multi-year waiver redesign project. What you see on the screen here are some of the areas of priority identified during our waiver redesign efforts over the last few years. And when I say identified priorities, these priorities were identified by individuals and families and other stakeholders that we did a significant amount of engagement with over the last few years and continue to do engagement. We anticipate that these areas of priority will continue to be areas of priority as they're really core to the broad enhancement of services and supports for individuals and families that BEAD supports today, and individuals and families that BEADS will be supporting post July 1 after the waiver transition. We'll continue our ongoing efforts to get feedback from individuals with lived experience and their families. As you know, the individuals and families served or supported through the Aging Disabled Waiver and the TBI waiver are not individuals and families that we have had as much contact with as we have with individuals and families supported through the Family Support Waiver and the CIH. So we will continue our efforts to get to know them and what their needs are and how we can best support them. We really feel like the waiver redesign, while it's been ongoing for a few years, the waiver transition really does provide us with a very unique opportunity to create some alignment across the entire home and community-based services array in Indiana or within FSSA. And as Kathy mentioned previously about the pediatric assessments, and that's just one area. And as we go through the waiver amendments tonight, I'll highlight some of those areas where we found some opportunities to create some alignment that would support or better support individuals and families through the waiver transition, and we will continue those efforts as we navigate the transition and, of course, the waiver redesign. Next slide. Thanks, Carly. So today, what you see on your screen is the current home and community-based services array across the Division of Aging and the Division of Disability and Rehabilitative Services. The Division of Aging currently has oversight of a variety of non-waiver programs, such as Choice, the Older Americans Act program, the Aging and Disability Resource Center program, the Adult Protective Services. And then Division of Aging also has oversight of the Traumatic Brain Injury Waiver that currently supports a little over 130 people, I believe. I think the last time I looked, it was about 132 or 133. And then the Aging Disabled Waiver. So you'll notice that we have separated out the Aging Disabled Waiver on this slide. That is really just to demonstrate what that will look like a little more post-waiver transition. But today, the Aging Disabled Waiver supports about 28,000 people that are 60 and older and about 11,000 people who are age 59 and under. And then, as you probably are aware, the Division of Disability and Rehabilitative Services, or the Bureau of Disability Services, currently administers and oversees the CIH waiver, about 9,000 people, and then the Family Support Waiver that has supports about 23,000 people. Next slide, please. Effective July 1st of 2024, when we talk about the waiver transition, this is a depiction of what things will look like post July 1st. The Division of Aging will continue administering and have oversight over those non-waiver programs they administer today: Choice, Older Americans Act, ADRCs, and Adult Protective Services. July 1 of 2024, individuals ages 60 and over that are on the Age and Disabled waiver today will transition to the pathways for aging waiver. And that is our managed long-term services and supports. And that waiver, as of July, will be managed or administered and overseen by the Office of Medicaid Policy and Planning. You see OMPP here because there's just not room on the slide for the Office of Medicaid Policy and Planning. So, but those are one of our partners, another state agency, so that we work very closely with. Come July, the Bureau of Disability Services will have oversight of the Health and Wellness Waiver, which is the A&D waiver today, ages 59 and under, the Traumatic Brain Injury Waiver, and then again, will maintain oversight of the CIH and the Family Support Waiver. Next slide. Thank you. So want to talk a little bit about what's out for public comment, and I'm going to look at my clock because I tend to talk a lot. So Carly, you might have to give me a signal to speed up. Currently out for public comment are the Family Support Waiver, the CIH waiver, the TBI waiver, the Health and Wellness waiver, and then the Pathways waivers. These waivers were previously out for public comment November 8th through December 14th. So when I go through each particular amendment here in subsequent slides, I will talk about what is in the amendments today, and then what items we shared during the public comment in November, December. I also want to note that there is a waiver amendment out for public comment now that was not out for public comment in November, and that is the Hoosier Care Connect waiver amendment. It was not due to be out for public comment until January, so it was not out in November. Next slide. Okay, the Traumatic Brain Injury Waiver provides support for people who have had or experienced a traumatic brain injury. The January waiver amendment draft that is out right now for public comment and out through February 16th, and I'll probably say that about 6 times by the time we're done tonight. It keeps the provider rates the same as the rates that were approved by CMS and that went into effect on July 1st of 2023. It also includes permissive language to return to the rate indexing that Kathy mentioned if the fiscal situation allows for it. It also adds transfers as an allowable activity under the attendant care definition. It removes the reference to exclusion for the family ownership of an agency. It clarifies the $15,000 vehicle modification cap as a 10-year cap and not a lifetime cap. And that is clarified in this set of amendments because of some comments that we received on the during the November-December public comment period, where we just needed to further clarify that it was a 10-year cap. It also clarifies the policies surrounding the allowance of services provided by LRIs, or legally responsible individuals. And Kathy has already talked some about that. It will permit for LRIs to provide structured family caregiving and will not permit for LRIs to provide attendant care. Now, for the TBI waiver, there were a number of items shared during the November-December public comment period. And some of these you will see across all the waivers. For example, we made some minor changes to language to align the waiver language across all of the 1915C waivers. The TBI waiver also in the November-December public comment period we shared that it does switch the waiver oversight from Division of Aging to DDRS, or the Division of Disability and Rehabilitative Services. We also, on the TBI waiver amendment, proposed adding a couple services. So we have been engaging with some individuals with lived experience who are supported through the TBI waiver and maybe are not supported through the TBI waiver, but have experienced a traumatic brain injury. And one of the things that we heard from them and their families was that they really wanted more residential options. Currently, structured family caregiving is available on the A&D waiver and the CIH waiver. So we saw the waiver transition as an opportunity to add structured family caregiving as an option on the TBI waiver. So we took that opportunity and we have proposed adding that service. We additionally proposed adding home modification assessment service on the TBI waiver. That is a service currently available on the age and disabled waiver only. And it is exactly what it sounds like. When an individual needs a home modification, there is an independent third party, not the contractor that does the modification, but an independent third party that goes out and does an assessment and develops the specs for the needed modification. And then those specs are given to the contractor or the home or environmental modification provider. We saw that as an opportunity to add a service that could potentially enhance the quality of the modifications that are occurring on these other waivers, like the TBI and CIH and FSW waivers. So we have proposed adding that service on the other waivers that it currently is not available through. So, and we also hope that in creating some alignment like that, there will be less confusion for families about what's available on what waiver. So additionally, on the TBI waiver, there's just some minimal changes to service definitions. And we did this across the board to further clarify service definitions, how services can be used, potential service outcomes, and just, again, to create more alignment across the waivers. Next slide. The health and wellness waiver amendment again, the health and wellness will serve individuals, children and adults age 59 and under who meet nursing facility level of care. The updates in the January waiver draft adjust the transition timeframe for continuity of care for existing service plans to a minimum of 90-day period to make it consistent with other managed care programs here in Indiana. Now, following that 90-day period, services may not be reduced or terminated in the absence of an up-to-date assessment of need that supports said reduction or termination. The other updates in the January waiver amendment draft clarifies the policy, much like we talked about already, around the allowance of services provided by LRIs. It revises provisions for the annual rate adjustments. And again, you will see that across all of the waiver amendments, that we're maintaining those rates that were approved by CMS effective July 1 of 23. And again, the waiver amendments include permissive language to implement rate indexing if our fiscal situation allows for that. Additionally, on the health and wellness waiver, it keeps the number of waiver slots consistent with previously approved slots. It adds an explanation of potential waitlist procedures and then clarifies language on selection of entrants to the waiver. Next slide. It also updates cost neutrality information on that waiver that is required in every waiver amendment. It revises language regarding auto assignments or when auto assignments occur for those who do not select an MCE, that is a managed care entity, and that's applicable for individuals who are aging out of the health and wellness and into pathways on their 60th birthday. Much like the TBI, it removes reference to exclusion for the family ownership of an agency and clarifies, again, that $15,000 vehicle mod cap is a 10-year cap and not a lifetime cap. Now, for the health and wellness waiver, in the items that we shared during the November-December comment period are very similar to what we've already talked about with the TBI, the minimal changes to service definitions, changes in language to better align all the 1915C waiver language, moving the oversight of from the Division of Aging to DDRS and BEADS. It changed the name to Health and Wellness Waiver. And I always say that's because 59 and under is not aged. I will attest to that. And then it changes the waiver target population to serve individuals age 0 to 59, because again, 60 and over will be served through pathways. Next slide. So we want to spend a little bit of time talking about pathways. Pathways will serve individuals who are 60 and over, who are age blind and disabled, and qualify for Medicaid services, or including those age 60 and over currently enrolled in Hoosier Care Connect, or qualify for both Medicare and Medicaid, or receive services through the Age and Disabled Waiver, or receive services in the nursing facility. Now, the update on the for the January waiver draft for the pathways waivers, again, as I talked about on the health and wellness, it adjusts that time frame for continuity of care for existing service plans to a minimum 90 days. Again, no reduction or termination in that following that time frame unless there is an up-to-date assessed need or assessment of needs that support a reduction or termination. Much like the health and wellness and the TBI and the other waivers, it clarifies policies around the allowance of services provided by LRIs, keeps the waiver rates at what was approved by CMS effective July 1, and includes the rate indexing language if our fiscal situation allows for that. And then the pathways for aging waiver draft keeps the number of waiver slots consistent with previously approved slots, much as with the health and wellness waiver. Next slide. It adds an explanation of potential waitlist procedures and adds a reserve capacity for individuals aging out of the health and wellness waiver, and that is to ensure continuity of care. It also clarifies the language on selection of entrance to the waiver, revises the language regarding when auto assignment would occur for those who do not select a managed care entity. And then, as with the TBI waiver, talks about removing the reference to the exclusion of the family ownership of an agency, and clarifies that $15,000 vehicle modification cap. So some things to note that were previously shared in the pathways draft is that this Pathways for Aging is a 1915 BC combination. And what that actually means is that the 1915B waiver authorizes the managed care piece of pathways, and the 1915C waiver provides the home and community-based or waiver services currently available on the A&D waiver for individuals age 60 and up. So pathways will be a Medicaid waiver that's structured to allow managed care entities, or MCEs, to manage and coordinate services and supports for those individuals 60 and over. Now, those receiving hospice services when they become eligible for pathways, as well as American Indians and Alaska Natives, can opt in to managed care. Any changes around service definitions are minimal and do not impact the actual services. All enrollees in Pathways for Aging are eligible to receive care coordination, and then enrollees who have nursing facility level of care will also be offered service coordination. I really want to stress that the service definitions and the Pathways waiver align with the current age and disabled waiver. So a lot of care has been taken to ensure that there is a smooth transition for individuals when they age out of the health and wellness waiver and into the Pathways for Aging. So those services available on the age and disabled waiver today are available on Pathways and what will be the health and wellness waiver. And that is because we want to make sure as people age into pathways that their services and things can remain the same, and they'll know what to expect. For more information on the Pathways Waiver Program, we have a link here. It's in.gov/pathways. There is a wealth of information about pathways available on that website, and we would encourage anyone interested to take a look at that. Next slide. So the Family Support Waiver, I'm sure most of you know this waiver supports children and adults with intellectual and developmental disabilities. So some of the updates in the January waiver draft, we're going to go through those. I'm going to spend a little more time on these because I think I know there's some questions about the family support waiver and the CIH waiver. So the updates in the January waiver amendment draft, much like all the other amendments we've talked about thus far, maintains those rates that were approved and effective July 1, and includes the rate indexing language should our fiscal situation allow for that. We have in the draft out for public comment now, we have added a priority category for individuals who are on the age and disabled waiver who are subsequently found to no longer meet nursing facility level of care, but who do meet the what's called ICFID level of care, or the level of care for the family support waiver. We want to make sure that if an individual is on the A&D waiver and they lose level of care, but they have level of care for the current BEADS waiver, that we make a family support waiver available for them. As with the other waivers, we clarified the $15,000 vehicle mod cap, clarified policies surrounding the allowance of services by LRIs. And I want to stress that with the family support waiver and the CIH waiver, there's been no change about paid family caregivers. Those things remain as they are today, with a 40-hour rule for relatives and LRIs not providing paid services. It also clarifies proposed changes to the behavior support service definition. And I'm going to talk a little bit more about that when we talk about the items shared during the November-December public comment period. So some of the questions that Carly has shared with us were around our emphasis on employment in BEADS. And I want to provide some additional context there, because in the items shared during the November-December public comment period, several of those changes were related to competitive integrated employment. So I think it might be helpful to explain a few things. So Indiana does have employment first legislation, and it was originally passed in 2017. And we appreciate the ARC's advocacy for this legislation, because they were really instrumental in getting that legislation passed. And what that legislation says is that it is the policy of the state to advance competitive integrated employment as the first and preferred option when providing services to an individual with an intellectual or developmental disability who is of working age, regardless of the nature or severity of the individual's disability. So additionally, and probably just as important or more important, we have, through the course of waiver redesign and other outreach activities that we engage in, our emphasis on employment is coming directly from individuals with lived experience and individuals with intellectual and developmental disabilities who say they want support in finding opportunities to engage in employment. And honestly, our waiver service array right now does not do that. We do not offer a lot of support, discovery, and that sort of thing through our waiver service array. So we are trying to change that. And in the items shared during November and December, we added a new employment service called Career Exploration and Planning. And that is an opportunity, just what it sounds like, for service through the waiver, where individuals can explore what might be careers for them, develop a sort of a profile, a career profile, of what they would like to do, and just help people think about competitive integrated employment, and how that could be a possibility for them, and creating that pathway for them. So that was shared in November public comment period as, one step towards addressing what we have been told is changes that we need to make. The other piece of the employment is that the amendment, the items shared during the November-December public comment also included halting the entrance of transition age individuals into facility-based pre-vocational services. That is also part of our look at our waiver service array to support community or competitive integrated employment. It is creating opportunities for those individuals and everyone to access services other than facility-based pre-vocational services that would lend or support their path towards competitive integrated employment. There is part of that plan, the Employment Systems Transformation Plan that was developed with individuals with lived experience, is to phase out facility-based pre-vocational services model that exists today. The state of Indiana is not closing sheltered workshops, but we do plan to stop reimbursing for facility-based pre-vocational services over the next several years. So during those several years, our intention is to work with stakeholders and gain additional information on what is desired and what is needed in terms of supporting individuals and creating opportunities to be employed in their communities, and to add additional service arrays to support that end. So career exploration and planning is one step in that direction. Additionally, during the November-December public comment period, we made some changes to the definitions of behavior support services and case management services. And these changes were really to support or clarify the role or potential role of case managers and behavior support professionals in supporting individuals towards employment outcomes. We also, as I mentioned, added home modification assessment service. Going back to the behavior support service, we received some public comment during November and December that some people that read that behavior support service definition, because of the changes we made, felt like we were saying that behavior support services should be directed only towards employment, which is not our intention. So we did made some other clarifications to that definition that are in the amendment that's out for public comment right now, to further clarify that employment is one area in which behavior support services can provide support to people. Next slide. I need to talk faster, Carly. The CIH waiver, I think this group knows who's served by that, but the updates shared in the waiver draft amendment are very similar to others, with the one difference is that it revises the count of expected participants due to, it says MFP. What that is money follows the person. The items shared during the November-December public comment period are identical to what we just talked about on the family support waiver. So I won't belabor that, but just want to note a couple things. There are no proposed changes in this amendment to the requirements for eligibility for the CIH. So please note that the CIH continues, and the only changes in the amendment are what you see in front of you. The only significant changes are what you see. So The CIH will continue. We have made additional changes, very similar to the family support waiver and what was shared in November and December. But there's no change in this waiver amendment draft that's out for public comment about with the eligibility for the CIH. Next slide. I mentioned earlier that the Hoosier Care Connect waiver amendment is also out for public comment. For those who are not familiar with that, because that is not something that I think BEADS historically has talked a lot about. So the Hoosier Care Connect waiver provides support to individuals 59 and under who are blind or disabled and who are also not eligible for Medicare and do not meet nursing facility level of care. Changes in this waiver amendment draft that is out for public comment right now. It just changes the waiver target population to serve individuals 59 and under, because again, 60th birthday means a transition to the Pathways for Aging waiver. As I mentioned, the Hoosier Care Connect waiver was not posted or amended during the November-December public comment period, but is out for public comment now. Next slide. So I've said public comment multiple times. That is ongoing right now. It will end on February 16th. And the planned effective date for all these things that we've talked about in these waiver amendments and the Pathways waivers is July 1st of this year. Next slide, please. So how to submit public comment. So comments on the health and wellness, the TBI, the family support waiver, and the CIH waiver can be emailed to DDRS waiver notice comment at fssa.in.gov or mailed. I'm not going to read that address. It's a long one, but certainly you can, any public comments can be emailed or postal mailed. It is important that if you have public comments that you email them or mail them via the post office so that we are sure to get them and include them in the public comment tracking that we do. If you have comments on the Pathways or Hoosier Care Connect waiver that is out for public comment now, those can be emailed to backhome.indiana@fssa.in.gov, or they can be mailed again to the address here. Please note they are different email addresses and different postal addresses. However, we talk. The DDRS and OMPP talk very frequently. So if you inadvertently send your public comment to the wrong email or the wrong postal mail, we will make sure that it gets to the right place. But certainly, please review the drafts and provide public comment if you choose. And that public comment period is open to February 16th. Oh, wow. That was almost perfect timing. I think I will just turn the floor over to any of the other presenters or Carly in case there is any final comments. But I just want to take this opportunity to thank everyone for joining us today. We do appreciate the opportunity to engage with you and appreciate the opportunity that Carly has afforded us today and again next week.
Yeah, thanks, Holly. I want to just shore up a couple of loose ends as we kind of wind down this evening's presentation. A couple of things to note. There is an existing recording on our website, on the FSSA website, that talk about all of these changes. So you'll have this information from the ARC's presentation tonight, but you also can go and review that. It's very similar. Talks about all of the waivers and all of the proposed changes. The things that Holly covered so well here were also highlighted there. So there's a couple of places where you can maybe save yourself some time from reading lots of waiver documents that Carly is currently working on. But you can watch those webinars and get the very high level, big substantive pieces of things that are being proposed to have changed. And so would very much encourage you to do that. And I would also encourage, I know a lot of this information we are going to be talking about again during the second session that Carly has offered to us next week. However, if there are additional pieces of information or additional questions that we are able to answer at that time, we will go ahead and do that as well during that second session. And I think Carly is recording both. And so you'll be able to access both. So if you can only join tonight and not next week's, don't worry about it. There'll be an opportunity for you to access the recording so that you'll have something to reference. And if there's any new information, you can review that as you are able to. A couple of things I don't remember us addressing in the presentation that came through as questions that Carly sent that I want to just touch on, and it's really around pathways for aging. You've probably seen, many of you may either seen or heard commercials about it. Hopefully you have, because we are trying to help educate people about this new waiver option. But Pathways for Aging is it will be a Medicaid administered program, but it will be a waiver. And so I know that's a little technical jargon. It is structured in a way that Holly mentioned earlier to allow managed care entities to manage and coordinate the home and community services and supports there. One of the questions that we did get was around MCEs. If they're all doing the same thing, then what choices are there really, and how will they be different? All of those managed care entities had to bid for the work to administer these services. And within that, they all have different, I guess, flavors. So I would encourage you to recognize and do some potentially research on them if you are somebody who is going to potentially be transitioning, because they have to offer the standard array of services and supports, but because of their uniqueness as a managed care entity, they may also provide additional or other options that individuals could consider in deciding and choosing which MCE that would administer their services. And so just making you aware there are a lot of samesies, a lot of the same stuff they have to do, but there's also some unique differences between each organization that would just want to make sure you, depending on what your needs might be, or maybe what your priorities are, would potentially drive you to make a certain decision about which MCE you would choose. And so hopefully that clarifies some of those questions. Things that we would do from a state agency perspective is that we would monitor those MCEs to make sure that they are doing everything that they contractually agreed to do, and doing some quality checks as well, some additional oversight there to make sure that not only is it being delivered in an effective, responsible way, but also that people are actually getting the services and supports and medical treatments that they actually need. You'd continue to get to choose what services and who provides them. So providers who provide services today would contract with an MCE, and you would have a choice of those contracted providers. Once you choose your MCE, you would be able to choose from that array of service providers. And so just some things to be thinking about as we move into that transition period. Communication is going to start going out soon to those individuals who are going to be in that initial transition group, really just kind of making them aware of some things that they'll need to do in order to make decisions about those MCEs and what they want to see happen. The only other thing I think that I just wanted to touch on, the changes being proposed related to the current forecast information. The waiver budgets at this point are not changing, and so the way in which those are completed are not changing. The caps on the FSW are the total cap isn't changing. The CIH budget allocations are not changing. So just want to make folks aware we're not making sweeping changes like that at this point in time. And so just wanted to hopefully alleviate or address some concerns there. The way in which people get onto the CIH waiver and FSW will not change drastically in terms of what that looks like. The CIH won't change. I do just want to note we did add additional priority category to the family support waiver. And so you'll see that as well. But that's really to kind of help recognize that people move from different waivers and making it easier for people to not maybe have to sit on that wait list if they're moving from one waiver to the FSW. So um, I think that covers the majority of the questions that were remaining that we are able to answer at this time. Again, we still have Carly's questions that she compiled and shared with us, and we'll continue to tick through these and try to answer all of them as we're able to. And may have some additional content or information to share next week. And so would just welcome anyone who's able to join again. You're welcome to. We'll walk through a lot of the same information, but there might be some new stuff mixed in there as we're able to, as we get new information, we're able to share that. I echo Holly's sentiments. This is a lot of information. It's very technical. It's very layered, and it can be overwhelming. And so sometimes people do need to hear it and talk through it a little bit and start thinking about what it means for them specifically, how to work toward planning for something different, and hopefully at some point working toward a waiver system that supports everyone across disability, across level of care. Our division is really committed to working toward that solution more holistically with people at the table, helping us think through that. I'll pass it back over to Carly, and can't thank you enough, Carly, for navigating the slides for us this evening, but also for compiling all of those questions and supporting individuals and families as you do every single day. So thank you.
Well, I want to thank you guys all for joining us tonight and being willing to talk about all of this. I know that there is a lot of fear and there's a lot of confusion and a lot of misunderstanding and misinformation out there. So thank you for being able to talk through this and really especially address specifically the changes between December and now. So I want to thank you so much for that and making it actually understandable. I know that we also have a lot of people who have submitted questions. First of all, I want to let you know that we will actually be posting a recording of this webinar tomorrow on our YouTube channel. There'll likely be a link through our website to be able to watch this. So if you want to go back and rehear something, check something that was said, you will certainly be able to do that. I know that since our last webinar, this is the second of a 3-part mini series. We had a session on Tuesday where we talked about how to submit public comment and how to share your story. You're welcome to watch that webinar as well. And we got some questions during that, or as a result of that we were able to submit for today, but we continue to get more of those. I know we have a lot of questions that have been included in the question and answer today. We're going to take those questions and we're going to compile those together to try to get some of those questions answered at our next webinar, which will be Monday at 2:00. If you are able to join us for that, great. You are already registered, so you're good to go. If you're not able to join us, I completely understand because it is the middle of a workday. We will record that and post it as quickly as possible. But again, I also want to stress public comment is due by 4:30 on Friday, February 16th. So make sure that you are sharing your thoughts on this. Make sure that you are sharing your story, submitting public comment to say what you do like, what changes you would like to see, so that those can all be taken into consideration in these waiver proposals. And again, I just want to thank Kathy and Holly and Leslie for taking the time to talk with us all this evening. And we will see you again on Monday at 2:00. Thank you everyone for joining us and have a wonderful night.